Okay, so welcome to our final video for this unit, or technically it's our first video for Unit 13, but we only get one because we combined units. So this is for treatments for psychological disorders. We're only going to basically touch on a couple treatments here. The rest of them we will do in class, but this will get you started, so take some good notes. All right. First, let's touch back on the history of insane treatment. Um, Maltreatment of the insane throughout the ages, as we saw when we looked at the mental treatment throughout history, everything from trephination back in the ancient times and the four humors with the Greeks and Romans, on up to the insane asylums and mistreatment in some of the video clips that we watched later on, was a result of some irrational views. Many patients were subjected to strange and very debilitating, downright dangerous treatments, like I said, with trephination, in order to cure their mental illness. And since then, we have come up with several other therapies that work a lot better. Um, so with history of insane treatment, we've talked about Pinel before, all right, in France, right? He's the one that said, hey, we actually need to treat them right. And Dorothy Dix is another one in America that founded Humane Movement to care for the mentally sick, all right? The first type of therapy we're going to talk about is psychotherapy. We've mentioned it before. This involves an emotionally charged, um, confining interaction between a trained therapist and a mental patient. All right, so we'll talk about that in a sec. Then you have your biomedical therapies. That's where you use drugs or other types of procedures that act on a patient's actual nervous system for curing them of their psychological disorders. So psychotherapy, it's like you're talking to your shrink. It's like a very Freudian thing. Um, Biomedical therapy is the use of medication. An eclectic approach is basically they're using various forms of healing techniques depending on what the client's unique problem is. It could be a combination of the two therapies up here. It could be something else. It really all depends on what the needs of that client are. So let's look at the psychological therapies. We're going to look at four main major forms of psychotherapy based on different theories from human nature. All right, psychoanalytical, humanistic, behavioral, and cognitive. All of these should be very familiar to us already. All right, psychoanalysis we talked about. It's the first formal psychotherapy that we had that emerged. We call it psychoanalysis, and this is developed by Sigmund Freud. And here, when you think of Freud and someone laying on the couch, this is the famous couch. This is Freud's couch. All right. The aims, so basically the goals of this. All right, so since psychological problems are very ornate and they're from childhood repressed impulses, according to this theory, and conflicts, the aim of psychoanalysis is to bring those repressed feelings that are buried in your unconscious to your conscious awareness where you can now learn to deal with them. When energy devoted to your id, ego, and superego conflicts are released, the patient's anxiety will lessen. So it's like you kind of got to vent and get it out of your system, and then it's gone. And then there you go. That's half the battle. So that was the aim or goal of psychoanalysis. All right, the methods for doing this. Um, Basically, Freud developed this method called free association that we talked about before to unravel the unconscious mind and its conflicts. So the patient would lie on the couch and speak about just whatever comes to mind, just whatever pops in your mind. Talk about this, right? And free association, we've talked about a couple different types of tests that they would use for this before, with the TAT and the Rorschach ink blot and stuff like that. That's all free association, right? During free association, the patient will edit their thoughts to resist their feelings and to express their emotions. Such resistance becomes important in the analysis of conflict driven anxiety. So, the reason that you're feeling this anxiety is because you're holding something back. And maybe you just don't hold it back anymore. Just let it out, get it out, and it's done with. Eventually, when the patient stops doing that and holding it back and they open up and reveal their innermost private thoughts to their therapist. And this could result in them developing either a very positive or negative, like transference of feelings towards their therapist. So they either create this really great trusting bond with their therapist and they're very open with them and they're happy with that and it helps. And it's a positive experience, or they can have really negative feelings towards their therapist about it, like, how dare you, you're making me relive these things, I hate you. So transference is you're putting your anxieties, good and bad, and you're kind of projecting it onto your therapist. Criticisms of using this approach. Psychoanalysis is hard to refute because it really can't be proven or disproven. Um, so there's that. It takes a long time and is actually very expensive, right? You keep going back to therapy over and over and over and over again. So it's very time consuming and expensive. You have your humanistic therapies, which the aim of that, so the goal of that is to boost self-fulfillment by helping people grow in their own self-awareness and self-acceptance. All right, so this is a good political cartoon here that kind of sums up the humanistic therapies. After many years of therapy, Waldo finally finds himself. That's basically what humanistic therapies do. What you have is something called client-centered therapy. You may or may not see it referred to as person-centered therapy on the test. Just know that they're the same thing. Client-centered, person-centered, those same thing. This is developed by Carl Rogers. Right, make sure you note him in here. We know that he's a famous humanist. So you need to make sure you know that he goes with this category if you don't already. So Carl Rogers developed this client-centered therapy as a form of humanistic therapy. The therapist basically, it's similar to psychoanalysis, but they're not delving into your past. The therapist basically just sits there and listens to the needs of the patient in a very accepting and non-judgmental way, addressing problems in a very productive way, and building up the patient's self-esteem. All right. The therapist will engage in basically that's active listening. So you're listening and you're saying, yep, okay, like just acknowledging that you're listening and just letting the patient talk. You echo or restate or clarify the patient's thinking. So you'll do exactly that. They finish a sentence and you'll kind of repeat what they said in the form of a question, kind of to get them to keep going. Or how does that make you feel? That type of thing. Um, and you're going to acknowledge the client's expressed feelings, all right? Really make them feel comfortable. And basically what that does is the person, they get all this stuff out, they're talking about it, and you're just echoing the same thing back to them, and they kind of wind up treating themselves. They're like, oh, wait a minute. I know how to fix this. It's a way of you're helping them to solve their own problem. You're not really, the therapist really isn't doing anything other than sitting there and listening, and the person kind of figures it out on their own. How wonderful is that? All right. Behavior therapy is a little different. It's a therapy that applies learning principles to elimination of unwanted behaviors. So they use this to treat phobias or sexual disorders. Behavior therapists do not delve deeply below the surface like the psychoanalytics do, looking for inner causes. They're merely trying to treat the behavior, what you're seeing. Right? So they're not trying to delve all the way back in the past to why this is happening. They're trying to fix the now. All right. They do this through a couple different things, and all these techniques we've heard of before in previous units. Classical conditioning, or they can use you can call it counter conditioning, is a procedure that conditions new responses to stimuli that trigger unwanted behaviors. All right. It's based on classical conditioning and includes exposure therapy and adversive conditioning. We talked about exposure therapy with Monk, all right, when we watched that video trying to get him to shake hands. All right, so they'll use classical conditioning to try and fix a behavior. Exposure therapy, I just said, where you expose the patient to things that they fear and that they avoid through repeated exposures. The anxiety lessens because they habituate to the things that they fear. Like they become used to it and realize, oh, this isn't so bad. It's not going to kill me. I'm all right. All right. Systematic. Uh, okay, I'm back. Sorry. Systematic desensitization. Sorry, I couldn't say it. It's a type of exposure therapy that associates a pleasant, relaxed state with gradually increasing anxiety triggering stimuli. And they commonly use this to treat phobia. All right, so they're going to associate something pleasant with what you're afraid of. So now you don't associate it with the anxiety, you associate it with something like awesome. You have aversive conditioning, which is a type of counter conditioning that associates an unpleasant state with an unwanted behavior. With this technique, you get temporarily conditioned aversions to alcohol, has actually been reported. So here, I don't know if you can see it, for some reason it's really blurry. So you have your unconditioned stimulus, all right, so conditioned stimulus. So like you're putting something in the alcohol that's going to, or whatever this is, to make it taste bad. So then you don't want it anymore. So that's basically what aversive conditioning is doing, is you're doing something to it that makes it bad and undesirable, so they don't want it anymore. They also use operant conditioning procedures. Um, operant conditioning enables therapists to use behavior modification, um, in which desired behaviors are rewarded and undesired behaviors either go unrewarded or they get punished. A number of withdrawn, uncommunicative 3-year-old autistic children have been successfully trained by giving and withdrawing reinforcements for desired and undesired behaviors. So that's kind of like another experiment that they did with this. So behavior therapy, right? You're using classical and operant conditionings and some types of like variations in between. All right. You could also use, we've talked about this before, token economy. All right. In institutional settings. So it's not like, oh, you get a sticker for doing good on your test, or you're getting all those Panther bucks or whatever, and you can use those. Right. It's not like that. It's in institutional settings. Therapists still use them. All right. They may create a token economy where a patient engages in some sort of like token that they can earn for exhibiting a desired behavior, such as various privileges or treats that they would get within the institution. Like you get to go outside, or we'll give you a free weekend pass, or something like that. All right. So that's all I have for the therapies here. We will learn more about it in class. There's a couple other key terms I want to talk about with you, but I want to kind of talk about them in person, and not just strictly rely on the video. So what you're going to do is from here, go on to Edmodo. I will post a quiz shortly. This one will be labeled, the quiz will be labeled Chapter 13, Quiz 1, and that will pretty much be the only one for this one. All right. So see you in class.